first, I'm going to start with palpations. The first thing I'm going to palpate is the acromion process, which is right here on the shoulder. Now I'm going to look for the iliac crests, which is right in here. And now I'm going to look for the ASIS, which is down in here. I'm going to look for the PSIS, which is, it would be right in here. Now I'm going to look at her spinal alignment, starting up top and going all the way down to see, make sure her spinous processes are in alignment, which they are. We'd be looking for abnormalities such as scoliosis. Now I'm going to look at her scapular position. So I'm going to look at her inferior angles. I'm going to try and get my thumb under the inferior angle on both sides and see if they're even bilaterally. Now I'm going to look at her medial longitudinal arches. So I'm going to be looking at her Achilles, and it looks like her Achilles bow slightly outwards. So if they bow outwards, that's a sign of pes cavus, and if they bow inwards, that's a sign of pes plantis. So now I'm going to look at my patient's rear foot angle. So I'm going to have her prone. I'm going to have her in a figure 4 position, and I've already drawn the lines, but this is our calcaneal line and this is our tibial line. The first dot is where the Achilles inserts to the calcaneus, and then the second dot is like a centimeter below that. Then we have just superior to the Achilles tendon, and then this dot is for the lower 1/3 of the leg. So I'm going to first get her foot into a neutral position, so I'm going to dorsal flex her foot, and then I'm going to look for her talus to make sure her talus is even on both sides by internally and externally rotating her foot, which is out here. So now I'm going to put the fulcrum on the Achilles, and the movement arm will be at the calcaneal line. So it'll be like this, and I am looking to see if it's between 2 and 8 degrees, which hers is about 3. And if it is outside the 2 to 8 degree range of supination, that could indicate rear foot valgus, which is pronation, or rear foot verum, which is supination. Next, I'm going to be looking at tibial torsion. So I'm going to have her on her back supinated, so her patellas are going to be up. I'm going to have the fulcrum on the base of the 5th metatarsal. The stationary arm is going to be parallel, and the movement arm is going to bisect the medial and lateral malleoli. And so I'm going to be looking to see that, and if should be between 15 to 18, which hers is about 16. The next thing I'm going to look at is her acute angle, which actually I still need this. The fulcrum is going to be on the patella. The stationary arm is going to be along the tibial shaft, and the movement arm will be over the ASIS, and hers is about 18. So for men, if the Q angle is greater than 13, and for women, if the Q angle is greater than 18, that is an implication for lateral forces, which equals a lateral tracking patella. Next thing I'm going to look at is Craig's test for femoral torsion. So I'm going to have her on her stomach with her knee off the end of the table, and it's going to be flexed to 90, and I'm going to be internally and externally rotating her femur, looking for the most prominent point of the greater trochanter. So and I'm going to have the fulcrum just distal to the knee. The stationary arm is going to be perpendicular to the floor, and the movement arm is going to be at the anterior tibial shaft. So it's going to look like this. And so I'm looking to see if there's any retroversion or anterior version. Her measurement is 13, so if it was less than 15, that equals retroversion, and if it's greater than 15, that equals anterior version. The next thing I'm going to look at is her pelvic angle. So I'm going to find her PSIS, which is back in here, and I'm going to be just lateral to it with the fulcrum. The stationary arm is going to be parallel to the floor, and the movement arm is going to find her ASIS, which is, here, can you hold this? Which is right here, and hers is about 12. So a neutral pelvis is between 8 to 10 degrees. If she were to have a posterior tilt, it would be less than 8 degrees, and if she were to have an anterior tilt, it would be greater than 10 degrees. Now I'm going to look at muscles and muscle tightness. The first thing I'm going to look at is her gastroc. So she's going to be on her stomach, and for all of these tests that I'm doing, both the ones that I did and the ones I'm going to do, I'd compare bilaterally. So I am going to dorsal flex her foot and make sure her foot is in neutral. And if she were tight and she had less than 10 degrees of dorsiflexion, that would affect her walking. And if she had less than 15 degrees of dorsiflexion, that would impact her running. And so now I'm going to do soleus, which is the same concept, but her knee is going to be flexed greater than 60 degrees, which it is. And I'm going to dorsiflex her foot again in neutral. And same thing, if there's less than 10 degrees of dorsiflexion, that impacts her walking, and less than 15 degrees of dorsiflexion, that impacts her running. Now I'm going to look at her hamstrings. So I'm going to have her on her back, supinated. I'm going to have her in a 90-90 position. Give this to her. And I'm going to extend her knee, and if she has less than 20 degrees of flexion, that indicates tight hamstrings, and I'd also compare it bilaterally. Now I'm going to look at her rectus femoris, so she'd be on her stomach, prone, and I'm going to flex her knee all the way down as far as it goes, and if she had greater than a 10-degree difference of knee flexion bilaterally, that could indicate a tight rectus femoris on whichever one there's a greater difference. Now I'm going to look at her scapular position. So I'm going to have her take her shirt off. And we've pre-measured the dots. So one dot will be on her T3, the other will be on her medial border of the scapula, and then dot on her inferior border of the scapula and T7. So I'm going to be measuring the distance between them. The top is 9 degrees, and the bottom is 8.5 degrees, and I'd be comparing this bilaterally. And if there was an increased distance, that would indicate pronated scapula. If there was decreased distance, that would indicate retracted scapula. And if the lower distance was greater than the upper distance, there would be upward rotation of the scapula. Now my patient is going to be in a hook-lying position. And the first thing I'm going to do is test her latissimus dorsi and teres major. So I'm going to have her raise her arm all the way up above her head, and she should be able to put her arm on the table. But if she's not able to, or her back arches when she puts her hand backwards, that indicates a shortened latissimus dorsi and teres major. The next thing I'm going to have her do is interlock her hands behind her head for testing her pectoralis major. So her elbows should be able to touch the table, but if they do not, then that indicates tightness of the pectoralis major and could lead to rounded shoulders and forward head position. The last one I'm going to do is pectoralis minor, so she's going to have her hands by her side. I'm going to look for her posterior shoulders, so they should be flat on the table, but hers are not, and you can check that by trying to see if you can fit your hand underneath. And so that indicates tight pectoralis minor and could lead to rounded shoulders and forward head position.